Welcome. Hello, my name is Krista Donaldson. I am the Director of Innovation to Impact at the Bayer Center for Biodesign at Stanford University, and I'm a board member for the Bay Area Global Health Alliance. So I am thrilled to be moderating this panel on reimagining healthcare in emerging markets, the future of healthcare innovation and investment here at JP Morgan. Before I get started today, I want to recognize our sponsor, the Bay Area Global Health Alliance. For those of you who are not familiar with the Alliance, it is a membership organization and a central network hub of more than 85 private and public sector members. And while the roots are in the Bay Area and there's a very strong tech focus, only about 40% of the members are here. It's a global membership. I'm not going to say much more because there's a few cards around the room and you can learn about more, and I want to shift to our amazing panelists. And today, in exemplifying the audience, we bring together an expert panel from diverse sectors to have a candid conversation about the opportunities in emerging markets. And we will have an amazing set of opening remarks from Raj Punjabi in a moment. But before we go there, I also want to extend a thank you to JP Morgan for elevating emerging markets in this dialogue. And I'd also like to thank my colleague at Stanford, Dave Milestone, who helped put this panel together. All right. With that, I want to start with some framing. While emerging markets might be relatively small now, they will not stay so. Credit Suisse reports that the global middle class has tripled in the last 20 years, and it is expected to double again in the next decade. By 2030, low and middle income countries will be home to 70% of the world's population. By 2050, Africa's population will match China, Europe, India, and the US combined. And Africa has the youngest population in the world, and this isn't going to change. And you have to think about, these are young people who are digital natives, and we're already seeing burgeoning innovation in digital health. What is this going to mean for global markets? So it is no surprise that emerging markets represent the fastest growing healthcare markets in the world. And furthermore, the pandemic highlighted the shortcomings in global healthcare infrastructure. And what happened? Governments are now much more motivated to respond. They're devising and revising healthcare plans to better serve their citizens, and they're investing more. Our panel today will look at how the investor and healthcare landscape is changing and the opportunities there. Before we turn to our panel, it gives me great pleasure to welcome Raj Punjabi to the stage. Dr. Punjabi. He's going to kick us off with some opening remarks. Today I'm going to keep all of the introductions of our panelists fairly short because you have them in your digital guide, but they're all rock stars. Raj, in particular, physician, entrepreneur, and former White House official. And while Raj was at the White House, he led the Pandemic and Biological Threats Office for President Biden as part of the National Security Council. And there he played a pivotal role in the largest global vaccination campaign in the history against COVID-19 and numerous infectious disease outbreak responses. I also personally want to mention that Raj co-founded an organization called Last Mile Health, and he was recognized, and Last Mile was recognized for its fearless response to Ebola in 2014 through 2016. For this work, he was named one of Time's 100 most influential people in the world and one of Time's most influential 50 people in health. Over to you, Raj.
Thank you, Krista. We're at that stage in the conference where the 3 B's of being brief, bold, and be gone is a must. So I will be all 3 of those things, or at least aspire to. Look, I couldn't be more excited about this conversation we're about to have. My experiences as a physician, as a healthcare entrepreneur, as a former White House official leading the Pandemics and Biological Threats Office really give me reason to feel optimistic. Let me just put a few numbers in front of you based on my most recent experience in the White House. So my colleagues and I helped oversee the largest global vaccination effort in history against COVID. Many of you were involved in that effort. 13 billion, that's the number of COVID vaccines that have been administered around the world, with over 2 billion just in India alone. That demonstrates capability in emerging markets. $10 billion. That's the annual spend that the United States alone is putting in to help prevent and prepare for the next pandemic through the American Pandemic Preparedness Plan and the biodefense strategy that was launched while I was in office by the president. $30 trillion. That's the estimated output globally before the end of this decade from bioengineering's impact on the manufacturing sector. And some of that will and can come more so from emerging markets. That was a prominent reason that the president last fall launched the executive order on advancing biotechnology and biomanufacturing. All of these components and initiatives have an emerging market focus. The United States and our partners in public and private sectors are investing billions of new dollars of funding into over 100 countries. I saw that in the United States, and while the president led efforts in the G7 and G20. So that all should give us great promise and hope about the role of healthcare and technology in emerging markets. I want to just give you a sense, walk you through 3 trends that I'm seeing, and then I'll hand it back over to Krista. First, fueled by COVID, the acceleration of digital health coupled with advancements in technology is paving the way for locally driven health tech innovation. The integration of analytics, including artificial intelligence, as you know, is empowering entrepreneurs around the world to create companies that are poised to transform health systems in these very markets. The second trend that we heard a little bit about from Krista already is that emerging markets are home to the youngest and fastest growing populations in the world. Emerging markets are home to flourishing startup activity in areas like screening, diagnosis, prevention, and care delivery. We also know that emerging markets are home to new momentum in health technology innovation, from early patient identification to leveraging digital diagnostics, from AI-driven imaging to innovative work on genomics, from enhancing wellness and disease prevention to ensuring that we improve clinical outcomes. The possibilities are expansive. The third thing that we're observing is that all of these trends are leading to real startup work and businesses succeeding in places from Brazil and Mexico to Rwanda and to India. They're developing innovations. They're developing more effective therapies and delivering health care through digital pharmacies. They're building virtual health assistants and delivering and building tech-enabled supply chains. They're driving innovations in value-based care arrangements and in health insurance. And they're strengthening benefits administration and transparent pricing models. These businesses collectively in emerging markets are increasing access and affordability of quality healthcare for billions of patients. And that's vital. Speaking as someone whose parents grew up in India, I grew up in Africa and spent my career here in the United States. Illness is universal, healthcare is not. But if we reimagine the way we all show up to invest in healthcare and technology in emerging markets, I think we can change that. And I think today's panel is going to show us in very pragmatic ways how that can happen. You're going to hear about market opportunities in emerging markets. Get ready, folks. You're going to hear about strategies to de-risk investments in frontier markets. And you're going to hear insights about tapping new forms of capital. And maybe along the way, we'll also bust a few myths about emerging markets. Thank you.
Thank you, Raj. We realize many of these opportunities exist, but we also know there are concerns for investors. So I want to put a few of them on the table to put the elephant out there. And I hope our panelists will address some of them as you talk about de-risking and opportunities. But we hear reasons not to invest: unreliable infrastructure, political and economic instability, limited and changing regulatory frameworks, limited data, insufficient workforce or insufficiently trained workforce, and then finally limited health insurance coverage. But at the same time, we see these considerations changing, and with them greater opportunities for investment. And so we will turn to our esteemed panel with that. And I'm going to do a very quick introduction because you can see all of us behind you, or behind us. On my far right is Ken Gustafson, the Executive Director of Social Business Innovation at Merck, where he manages the company's venture capital and impact investing portfolio. Next, you have Prashant Yadav, is an affiliate professor of technology and operations management at INSEAD and academic director at INSEAD Africa Initiative. He's also, what's not written, he's a globally recognized scholar in the area of healthcare supply chains. And not least, Nafisa Jawani, the Managing Director for Health Initiatives at the U.S. International Development Finance Corporation, so DFC, and you'll hear us refer to DFC. I'm going to kick us off with Ken on the far side. You, at Merck, you offer the perspective of a Fortune 500 company. You also have social business in your title. So I would love for you to share with us, how does Merck think about the economic versus social returns, and how are you thinking about emerging markets?
It's on. Thank you. I think what Raj said, I think that's the answer.
We can all go home now.
Yeah. So thanks for the intro and the segue. So at Merck, I'm part of a group called Social Business Innovation. And within Social Business Innovation, we have an impact venture capital fund. And so from the perspective of that vehicle for these types of investments, we've been doing that for about a little over 5 years now. And I think one observation is that I don't think 10 years ago, we couldn't be having this discussion. And so all the things that you mentioned, the things that Raj mentioned, are things that are really accelerating and creating the opportunities that we see for investment now. From our standpoint, we get the question a lot, well, are you impact first or are you return first? And my answer is usually, well, yes, because there might be a little bit of a trade-off, but we would look at the opportunity as being representing mutually reinforcing social impact and financial return. And those are the sorts of opportunities that we look for and we think that are there. Our fund, our Venture Impact Fund, is a $65 million fund that's about 80% deployed. And so we think there are real opportunities there, both in terms of fund investments and direct investments. And when we look for these opportunities, we're looking for investments in therapeutic areas that are strategically aligned with what we care about as a company. So we want to have that alignment. We look at geographies where we are either currently operating or we might operate in the future, because investments like these, as Raj was alluding to, they can build that infrastructure. Or as you alluded to, there might be insufficient infrastructure, but that's a reason to invest. How can we build that infrastructure for the future? From a thematic standpoint, we're looking at opportunities in things like digital health solutions, supply chain, diagnostics, financial inclusion, health insurance, life insurance, payment mechanisms, and things like that. And we found that the opportunity of investable vehicles, whether they're funds or direct opportunities, just continues to increase. So we are mostly invested in Southern Asia and Africa, where there's a lot of opportunities. We're seeing growing opportunities in Latin America. And from an impact standpoint, we find that our portfolio is reaching between 5 and 10 million people a year just for our slice of the dollars we deploy. And at the same time, we're more than breaking even and having very solid financial returns that go back to the corporate balance sheet, that we also have an objective to redeploy those returns to make more investments. And then from a strategic standpoint, we look at opportunities where the company from an enterprise business perspective can engage with portfolio companies. And so the opportunity is real. It's not a trade-off. And it's exciting to see that as the momentum continues to build, that more participants enter in. We have great collaboration with other pharmaceutical companies, other corporate venture groups that are looking at continuing to build the space of the ecosystem. So it's a good place to be.
That's great. Just out of my own curiosity, I'd love to know of the investors in the room who are already investing in emerging markets. I'm going to raise your hands. Okay, just to get a sense. Great, thank you. And are there companies here who have operations in emerging markets? Wonderful. Okay, great. Thank you. I think this is helpful for all of us framing, because there's a lot of other in here too, and everyone's welcome, of course. Prashant, I'm going to turn to you because I know you advise a number of companies making investments and building operations in African countries. Perhaps you could share your perspective on some of the historical barriers to investment and maybe how they're being overcome. We'll start there. I have a few more questions for you, but we'll start there.
Thank you. So I want to start by saying that innovation in biotech, biopharma is global. That's something we all have to accept. And while emerging markets start getting ready for innovation and the ecosystem for upstream science, I think on the delivery, on the downstream delivery science, a lot of innovation is already happening. But if you're a company and you don't necessarily think about launching your latest health technology in emerging markets, one of the common reasons that comes up is, well, it's regulatory fragmentation, it is payment fragmentation, the distribution structure isn't ready, how do I get my product to the patients, and how do I learn about the data, and is there even diagnostics infrastructure? Right? Those are 4 things. They are not new to anybody. We've heard them many, many times. And to some degree, yes, these are salient problems. But the real excitement in the last 5 years is that they are being overcome by social entrepreneurs who are using new business models because they are from the region, the country, and they see the problem firsthand and they say, I've got to solve it. And in solving it, they are tapping into many different forms of capital, many different forms of technology, and many different forms of business model. In many cases, they are creating entirely new business models, which will help us in overcoming similar barriers that we face in our regions or the regions that you all may be more embedded in. So instead of being abstract, which a business school professor has a chance of being, I will take examples. And the usual caveat, this is not investment advice. I'm going to take examples of companies to illustrate a point. So the first one, diagnostic infrastructure is weak. Because of that, we can't launch our state-of-the-art portfolio products in many markets. Now, one of the things that Raj highlighted is we've built a very strong infrastructure of pathogen genomic sequencing, of PCR machines, which have become so commonplace now, right? And if you look at the pathogen genomic sequencing machines, well, we don't have enough pathogens to sequence. We want to reprogram them to do human genomic sequencing. We want to use them for running cancer care. It's an opportunity. Second, direct related opportunity is biobanking. There are places which have accumulated biospecimens over long periods of time, and that is a different genotype and phenotype for which biobanking we've not explored, right? So those are real opportunities that came up because of what we've done in the last 4 or 5 years. So that's on diagnostic. Lots of interesting ideas. I won't name companies, but if you want to, I'm happy to share details. The second is on delivery systems, which is how do I get my product to the patient? My product requires cold chain. Integrity is important to me. I can't let it run through these very outdated systems. Well, we've got changes happening there. A company called Zipline, which we all used to think is sort of a marginal operator. How are you going to fly medicines in a drone? But I encourage you to visit. They are here in South San Francisco, or visit their operations in many of the countries. This is something that started in Rwanda, delivering blood and blood components first, now delivers a full variety of product in Ghana, Nigeria, and Rwanda. And in addition, for Novant Health Systems in North Carolina and in Virginia, and with my former University of Michigan medicine colleagues and so on, right? So this is a clear example. Very investable company, which did get investments. So that's on the delivery system side. Payment systems. Again, we worry about payment systems, non-existent, very fragmented. Who will pay for my drugs? And I'm not saying that if you have cell and gene therapy, that is something that there is a payment system for. That we are not even able to solve the problem here in the United States. But if you have a primary care focused portfolio, or even a secondary care focused portfolio, then the payment systems are changing very rapidly. The government of Rwanda paid a telehealth consultation visit at the same rate as it would pay and reimburse an in-person visit, long before we did this in COVID, right? So very progressive in thinking about payment systems to encourage digital health adoption. The company in question did benefit from such a system. The second is that a large part of the market is out of pocket. It's not necessarily that governments are reimbursing. And in a way, you might say, that's not a good thing. We have patients paying out of pocket. But in the short term, that is an interesting opportunity. When patients are paying out of pocket, you don't have the gatekeepers of a payer who's using some kind of very fuzzy and complex math to determine whether to reimburse or not reimburse. You've got a straight way to get the product out to the patient. The companies that are doing it, direct to consumer delivery, Kasha in Rwanda and Kenya, gets its product out to people's homes at a cost point which I used to be very skeptical of, but now I'm encouraged that we can make it happen in geographies which are considered to be somewhat infrastructure challenge. A company called M Pharma, which has a very interesting model, has attracted capital from many different private investors. A company called Pendulum Systems, which uses AI and machine learning to predict loss to follow-up. And it started in the US in San Francisco and Utah and was trying to predict why don't patients show up for their specialist appointments? How can we use machine learning algorithms to predict who will not show up? Now we use it to predict who will not show up for their vaccination drive, who will not come for their antenatal visit, right? And that's an opportunity where we've used both sides of these together. So anyway, I can go on and on. The number of opportunities are immense. The number of companies that are doing and solving these problems are great. They are investable. There are two perspectives to this. If you're a company, these companies are vehicles to get your product out quickly. These are vehicles to solve your infrastructure and fragmentation constraints. If you're an investor, they are investable deals in many respects where you can put capital and get a reasonable market return from it if you have the patience of waiting for a certain period of time. Thank you.
Thank you, Prashant. And I think also adding, things are moving very quickly. And to underline one of the anecdotes that Prashant just told us about with Zipline, I was visiting a hospital in Butaro with a Stanford colleague maybe 6 months ago, and I asked one of the hospital workers, I wanted to see the drone land at the hospital, so I was kind of hanging out near the landing spot, and so I asked one of the hospital colleague who was showing us around, I said, so how many land per month? And he said 12 per day. And so it really, it made me check my own biases and expectations around how quickly things are moving. So thank you for that. I'm going to turn to Nafisa, who's at the DFC, as we talked about. You are making big bets with health investment, which I think is very exciting with the backing of the U.S. government. You're also looking to encourage others by de-risking these investments. So I'm hoping you could maybe start us a little bit with what is the DFC and how are you doing this de-risking?
Sure. So I'm going to start with giving you a little bit of context. We're talking about the type of investments and what's happening in low-income, low-middle-income countries. Let me just tell you where we started. In 2019, I arrived from the CDC to build out our healthcare practice. When I went in, I was like, what's the number of investments that our agency is doing? And they're like, it's really limited. It's $200 million in our active portfolio. In 2020, we launched our Global Health and Prosperity Initiative, and we're at $3.1 billion. So there is incredible opportunity. I'm in a position to where I'm not having an issue in terms of my pipeline. I'm having an issue with getting money out the door fast enough. So are there opportunities? 110%. Is there incredible innovation to, two of the companies that Prashant talked about are two companies that we invested in. I'll talk a little bit about those as well. But to give you a little bit of background, what is the DFC? When I was at the CDC here in the US, working as a public health practitioner, and I was working in policy strategy, I had no idea that the US government even had a development bank because it was really quiet. But our goal as a development bank is to increase private investment into emerging markets. And so how do we do that? We have a suite of tools to do that. What we know best is debt financing and political risk insurance, which helps companies that are looking to go into an emerging market have a little bit of security in going to that market with political risk insurance. And there's only two companies that provide that. That's the U.S. Government's Development Bank and the IFC. And the IFC's political risk insurance tool is designed after hours. But we work very closely together on these investments. And it's important because as you're going into an emerging market, you do worry about whether or not there's going to be instability, and political risk insurance helps you with that. So debt financing, political risk insurance. We have money now, so we transitioned from the Overseas Private Investment Corporation to the DFC. We now have an equity tool, which is really exciting. For equity, we're looking at investments that range from Series B to Series C, and we look at 10 to 15 million is our sweet spot for equity. We have a TA tool that's really used to support debt financing, either as pre to a project or post to a project. We have funds, we have loan guarantees, and I think I went through all of our tools, which is really exciting because our suite of tools has really expanded since we transitioned. And so what are our priority areas for health? And I have to give a big shout out to Prashant because as we were developing our strategy back in 2019 and 2020, he was really instrumental in saying, the DFC should really be thinking about this. And so a big thank you to Prashant for that. So our investments that we're prioritizing fall into three different buckets. The first is around health services and delivery. So anything that is infrastructure. That could be a hospital, it could be a clinic, it could be a dialysis center. So anything that's brick and mortar, that's our first. The second priority is really around manufacturing and supply chain. I would say that OPIC, prior to becoming DFC, had a lot of competency in the health services and delivery space. Since we transitioned to the DFC, we've really increased our portfolio in that manufacturing and supply chain space. And what's exciting is because we're building that portfolio, there is a need to now build an entire ecosystem to support a biotech sector in different parts of the world that just wasn't there before. So it's really exciting to see. The third area is something that Prashant talked a little bit about as well, this intersection of health and technology. And that's really, again, an exciting way where you're providing digital solutions you otherwise wouldn't see. And we've had success in each of those. I was going to talk a little bit about Kasha when you talk about investments. Just to give you some scale and scope, we did $1 million in equity to Kasha. From that $1 million in equity, they made $50 million in revenue. That is no small feat from $1 million in equity. They expanded to Kenya, Rwanda, and now are looking, we've invested another $3 million so they can expand into South Africa. It's really super exciting work and I would say transformational as well when you think about the work that they're doing. Hawatele is a medical oxygen supplier. Again, when you think about what was happening during the pandemic, there's a shortage of oxygen. We did a $10 million loan to Hawatele in Kenya. And then Helium Health is this, really this intersection of digital health and our focus there has really been to support them with $10 million in a guarantee of local currency. And it's really helping them to on-lend to other SMEs as well. So it's been really exciting to see our portfolio grow. And we work closely with our USG partners. So I worked very closely with Raj at the NSC, with our State Department colleagues, with our colleagues at USAID and HHS. And so when we think about an investment, we think about a couple of things. One, we're patient capital. We provide long tenors. We provide really competitive interest rates. We're not concessional financing, so we do expect a return. But we look for the development impact and the foreign policy impact. I hope that gives
that
you
was
a little
great.
bit of...
Yeah. Now I feel like you set me up for my next question too,
perfect.
which is for investors and companies who want to leverage the DFC, how do they do that?
It's actually pretty simple, surprisingly.
Which the reason I ask is it's not always simple when the U.S. government's
That's exactly
involved.
right. That's exactly right. So I know because I was at the CDC and it was definitely not easy to talk to private sector, but that is the job of the DFC is to talk to the private sector. I will give my card out. We can have a conversation at any point in time. If you have an interest inside of an investment that you want to talk to us, there's no problem at all. We actually really encourage that. I'd rather you come to me and say, can we do this? And we start having a dialogue about the types of investments that we're looking at. I'll give you a sense of what our eligibility requirements are. That's very transparent. But it gives you an idea of if you're going to come to a DFI, what does that look like in terms of that engagement? And what does that timeline look like in terms of working with us as well? And then when we have an investment, we try really hard where that investment has a connection to one of our USG partners to bring them in as well.
Thank you. Yeah, that was great. Thank you. I feel like we're covering a lot of ground. I do want to return to this aspect of risk-return trade-off. And Prashant, I'm going to go back to you for that, if that's okay. What tools can tech and pharma companies, leverage to better serve emerging markets and thinking about these trade-offs?
Yeah, so I think the simple way to view this is risk is high, or at least perceived risk is high, and the ability to price that risk is low just because the willingness to pay or the ability to pay is not commensurate with the risk, right? That's the equation that everybody faces, which is what dilutes the investment case in many such deals. People like Nafisa, others have thought about this systematically and have come up with a toolkit of instruments that can shift either the risk side or the return side of the risk-return trade-off in ways that create the proverbial win-win type of equation. So examples are volume guarantee, right? So if you're entering a new market, you don't want to make the investment because you're not sure if the demand will actually materialize or not. Now we have a range of structures that de-risk or create a backstop for unmet demand in the form of a volume guarantee. When to use it, when is it the best instrument, what kinds of therapeutic areas will we apply it in? Yes, those are important, interesting conversations to have. But we have a toolkit called volume guarantee. The second is, if you want to change your risk-return equation and you want to take concessional debt, we have a concessional debt tool that comes from DFC, from IFC, from EIB, many different vehicles that provide concessional debt, which changes the equation of if you're pursuing a project of expanding into a new market, and you want to think about, well, am I going to meet my return on equity or my internal IRR threshold Well, we can change that by highly concessional debt. So you don't have to meet your internal IRR in the standard mainstream manner. You can look at this slightly differently. So that's the second tool. A third tool is that when we think about going into new markets or new regions, we oftentimes say, let me establish customer density first, or patient density in the tertiary hospital. Let me go after that one academic medical center that provides cancer care in the capital city of the country. Because I have limited management bandwidth, my country subsidiary, the manager or general manager in the country, can't be running after hundreds of district hospitals. So that's where we want to use grant monies or other forms of capital, which is not necessarily returnable, which means we could then think about, well, can we have staff who are paid for using an alternative method for payments so that it doesn't dilute management bandwidth issues? The general manager can still focus on that academic medical center, which gets you 80% of the revenue in the country, but don't forego the remaining part of the market. For that, use other vehicles to go after. So those are my three.
Okay, well, thank
types.
you. We'll always take tools. Ken, I want to turn back to you, if it's okay, too. And I'm going to pick up on something Prashant said, too, about serving newer markets. And you had also mentioned in your introductory remarks, too, around working with local entrepreneurs. How is Merck thinking about identifying them, but also supporting them?
The last part, identifying.
Supporting local entrepreneurs and innovators. Yeah.
Through our investments.
Yeah, your investments, sorry. Thank you for clarifying me.
So a couple of ways. So when we invest, we will often play a governance role in the company or in the fund, in our case, always as a non-voting board observer. But in that capacity, allows the individual who has that board role to directly support the entrepreneur. And in addition, we can then use that as a conduit to tap into expertise within the company. So we had an investment. We have an investment in a company that was looking at exploring some new opportunities in data monetization for data that they were generating. And I don't know about data monetization, but there are a lot of smart people at Merck who do. And so you ask around, you find the expert, and then you help that person have a discussion to get some expertise in that. We've also paid for some outside consulting support on different issues that a portfolio company might want to pursue. And so there are a lot of different ways that we can do that to support entrepreneurs. And then finally, some of our offices around the world have their own local in-country incubators and accelerators. And we can bridge that connection so that they can participate in those opportunities.
That's great. Yeah, we're certainly seeing a number of incubators and accelerators starting in all parts of the world, too. So that's wonderful you're partnering. Nafisa, I'm going to give you the last question before we open it up for Q&A. I know the DFC is trying to crowd in new money, new deals, new ways of doing business. Can you talk a little bit about how you're trying to do that?
Sure. Well, one, I will say it's been an interesting ride over the last 3 years in working with other DFIs. And I say that because I think that there's a world in which we're learning that there's a capital stack that we can work together on. And it really shares the risk on an investment. So where we may not be able to provide equity, another DFI will give that equity where we can provide, large sums of debt. And it really then sort of changes the structure of that transaction. So we've been working really closely with like-minded DFIs across the world, and it's been really exciting to see the types of investments. And one example is with Aspen Pharmacare in South Africa, IFC led a syndicate loan, but was able to provide $600 million in working capital for Aspen Pharmacare. At the time, it was focused on fill-finish capacity for COVID-19 vaccines. And to me, that's an exciting example of DFIs taking a risk, crowding in financing, and now from that financing, they have an agreement with the Serum Institute of India, and they've been able to receive $30 million from Gates and CEPI to support that tech transfer. And so that's an exciting way of saying, look, DFIs will take that risk at the front end, and that's where we should be playing a role. And then how does that crowd in financing otherwise? I also think that the U.S. government in particular, you've got the U.S. government backing, which is no small feat. It's not easy necessarily to get a grant, let alone a loan from the U.S. government, but you have support from the U.S. government well beyond the financing that you'll receive from us. And so an example of that, I would say, is we're looking at increasing investments in the biotech sector in Senegal, And, we talked about the regulatory environment as being a challenge, but we have USAID coming in to strengthen the regulatory environment for that country because of that investment. And so it's another example of how the USG comes together or how other DFIs come together. Or we've also worked very closely with Merck on Merck for Mothers, which is a great initiative and collaboration with Merck. And it's a way for us to be able to crowd in funding from both entities too.
Great. I would love to open it up for questions. We don't have much time left, and I'm going to do a lightning round with our panelists at the end. But are there any questions from our audience? I see a hand right here. Do we have a microphone? Thank you. If you wouldn't mind hanging on one moment, we're going to get you a microphone.
Hi, my name is Wilson from East Ventures. I'm from Indonesia. So I have two questions. The first one for Prasan. Do you have a sample of how the emerging healthcare investment in emerging market exit? Because to give you a bit of context, Indonesia is the fourth largest, most populous country in the world, and I think we have been very successful doing digitalization in the country. We have over 300 portfolio. Many of them has been like in the $1 billion. Because of the COVID, we start getting into healthcare, and while it's great that there's a lot of DFI or institution, but actually it's very difficult to raise money because the first question will be, how are we going to exit? That's the reasons, if you could explain a bit how actually, or you have a sample from other country, how actually the investment could exit. That's the first one. The second one, I agree with the three things that you mentioned about deliverable through digital. You talk about the biobank. We have been doing that in Indonesia as well, working closely with the government. But the biggest problem is all the technology controlled by a rich country. The reagent, the mixer, we pay in US dollar. There's no way we can build a biobank for 200 million population, 270 million to be exact, with that kind of price. Do you have any kind of like a solution that apply in other countries that we can try to learn? Thank you.
Over to you with those small questions.
No pressure.
So, secondary market for investment exit. I think the best secondary market is large conglomerates in the country who are thinking about where to deploy their surplus capital, right? So instead of waiting for a secondary market to evolve that is very systematic and consists of investors who exclusively are looking for deal exits to invest in, the only route that seems to have worked is large conglomerates in the country which have a large balance sheet across different industries, find something interesting when it reaches a scale, and they say, oh, I don't have anything in telehealth. This Indonesian telehealth company looks attractive. Let me see if I would like to invest. So that's the only form of exit that has seen some saliency. Others probably will develop over time. It will take some time for a secondary market for exits to develop. We'll see. So that's the answer to the first question. The second, on the biobanking, I don't have examples of where people have overcome what you're describing as cost barriers to do biobanking at large scale. But we have examples where labs are exploring the idea with a specimen bank that they have, and that doesn't require new capex to do this because they already have started banking and having the specimens. It requires more OPEX. And yes, raising OPEX is not always simple. But those are existing labs who have specimens. But I don't have very clear examples of how to solve a population-level biobanking problem.
Thanks. I was hoping we could do one more question, but the panel will be around. Oh, okay. Do you mind asking a quick question? We'll do a quick question. Sorry. Microphone. Sorry.
A minute.
Thank you. It's coming, too.
As we are Thank you.
Thank you.
As we are reimagining healthcare in the emerging markets, let's face it, we are struggling with healthcare in our developed markets, right? So could there be models, or are there models already from the emerging markets that could help us improve our developed countries' healthcare?
Me?
Yeah, you want to take that?
I think the short answer is absolutely yes. We've seen examples in our portfolio, certainly of companies that are operating in dual markets and providing their solutions in the developing world and in the developed world, sometimes moving directly from the developing world to the developed world. And oftentimes they're doing that with a solution that was created in a resource-constrained setting, in a more necessarily innovative setting, so that then when it comes to a developed setting, it's even that much more efficient and cost-effective in so doing. So just one quick example, we had an investment through a fund in a company that was doing very simple new technology for cataract surgery in East Africa, which then was bought by a global big optics company who said, this is great in East Africa, but also we think we can do it in Europe and in the United States using that simple technology, same effectiveness, much less expensive and easy to deliver. So absolutely, yes.
I think in some ways we almost ignore the changes in emerging markets at our peril, because we are seeing some things moving much, much faster. I think going back to Prashant's comment around payment systems. So I don't want to have the last word. We are going to do a rapid round with our panelists. Very quickly, what are you most excited about for investing in emerging markets, or emerging markets in general for healthcare? We'll start with you, Ken, because we're all looking at you. That's why we're starting with you.
I'm most excited to see what's going to come next, because the range of investment opportunities continues to grow at an exponential rate, and seeing where those opportunities are and seeing the kind of transformational impact they will have in both the developing world and then, to that last question, in the developed world as well.
I'm most excited about new delivery systems, which once again will serve other markets in the future. And when I say delivery systems, not just how you get product to patient, but also batches, new delivery mechanisms and devices, filling not vials, but med-instilled bags, like those kinds of delivery innovations, which are happening or starting to happen.
I am incredibly encouraged and excited about building out biotech ecosystem across the world. I think it's an incredible opportunity, and we're seeing a lot of advancement really quickly. People said that we would never have vaccine manufacturing on the continent the way that we're seeing now. Big surprise, and I think that there's just an opportunity for us to do so much more.
So with that, I thank you all very much, and I thank Raj Punjabi too, so thank you.